Hi, I'm Renata Lutz. I'm 42 years old. I'm a mom of two little boys. I'm an ovarian cancer survivor. I had my boys post ovarian cancer. If you asked me at the time if I had any ovarian cancer symptoms, I would say I did not. But looking back on the years prior to this, I had bloating, I had explosive diarrhea, I had abdominal pain. I had been to a gastroenterologist because I did believe I had some kind of gluten or lactose intolerance, and it was not diagnosed at the time. The doctors never ever thought about ovarian cancer. So when I went to the doctor here, he told me, you know what? Even though if this is nothing, it's just a benign cyst, I do recommend you take it out ASAP because it was 7 centimeters at the time and it could create like a torsion on my ovary, and that would be an acute abdomen emergency. I was not staged at the time. They thought it was a stage one. I didn't have any cancer on my tubes, only on that uh, ovary. So for granulosa cell tumor, it's 1% of all ovarian cancer. Is a very, very rare cancer on a rare cancer. And it's a slow growing, is known to be like a slower growing, it's not super aggressive. So the treatment for that type of tumor is surgery. So I had 3 surgeries throughout my life to remove it. And the agreement with my gynecologist oncologist is that we're gonna do surgery for as long as needed, because there's not, for being such a rare type of tumor, there's not a lot of uh, big studies on how chemotherapy would work. Or so we agreed that at this point, since I have no evidence of disease, that's all we're going to do. So the moment that I discover my recurrence, I was already trying to get pregnant for about, I'm going to say almost a year. I just didn't have periods at all. I stopped my birth control and I didn't have periods for almost a year. Um, I We didn't know if it was because I was in birth control for so long in my life, because I started having like ovarian cysts when I was a teenager, just like functional cysts. Um, so we didn't know if it was because it was so long. And so when I had the recurrence, we were already trying to get pregnant, my husband and I. And when we found that I had the recurrence, we had the surgery and then we had this conversation with my doctors. And both my oncologist and my regular gynecologist, they were very supportive in whatever like we wanted. There was not a lot of knowledge around what could happen. So my first pregnancy, I knew exactly like pretty much before I even was supposed to have my period, because we were monitoring it and testing and doing like the fertility strips and like really like on top of it. So I knew immediately I was pregnant. Um, I didn't have any like major symptoms. I was just tired, very tired my first trimester. But I didn't have any type of like sickness or morning sickness or anything like that. So it was a pretty smooth uh, pregnancy. My oncologist kind of dismissed me. She's like, you know what? I don't want to hear from you until you have that baby. She's like, I want you to enjoy this time of your life. I want you to not think about cancer. She's like, just go and like enjoy every single bit of this pregnancy. And I took her advice and I really like enjoyed that. So I had my first baby in 2015. Um, he was born on a natural unmedicated birth, which I didn't have a birth plan at the time. My focus was I want to stay healthy. I want to come out healthy, and I want him to come out healthy. That was my birth plan. Like, I didn't focus on how it was going to be. I didn't focus on anything. I just said, I'll do whatever you tell me that will give me this baby healthy. So that was my mentality, like going into birth. And he actually got me by surprise, to be honest. Feel that he's the reason of this unmedicated birth and not me. Because he came in so fast, and it was such a surprise. So I started labor the night before, like a few contractions. The contractions went over throughout the night. I was able to sleep through most of it. And then in the morning, it started to get a little more intense. My husband went to work. I called the nurse line and I said, you know what, it's not regular, but I'm having these contractions and I'm feeling a lot of pressure on my hips. And she's like, you know what, you can come in and just get checked. She's like, there's no there's downside to it. So I called him, he picked me up. We went to the hospital. They checked me. I was about like 3 or 4 centimeters, and they're like, you know what? Walk for 2 hours around here, the floor. And if you progress in this 2 hours, then we're gonna admit you. But you never know how fast you can progress on your first pregnancy. So I walked for 2 hours around that delivery floor, and then it started to get like really intense, the pain. So I went back to the room. The nurse came in. I was at that point at 7 centimeters. She's like, you're progressing well. We're gonna admit you. So she started like filling out the forms. Um, and then I said, I think I need an epidural because it's getting really like intense. So she told me, go to the bathroom and empty your bladder and then come back. And as I went to the bathroom and I was in the toilet, I heard this big blob and I panicked because at that point it was my kid that was in the toilet. I thought literally I thought my kid was in the toilet. So I was panicking. So I start screaming because I didn't even want to look. And then she runs in, my husband runs in, and she's like, are you okay? Like, can you walk back? So it was my water that broke. But as a first time mom, I had no idea how a water break would feel, especially when it flops in the toilet. So I went back to the bed, and then the midwife came and she's like, I think you can do this. And I was like, no, I think I need an epidural. And she's like, well, but you need to be very still for the doctor to do an epidural. And at that point, my entire body was contracting. And he came like 15 minutes later in like a rush. The boy came in a rush. I was like a little shocked from like what happened in this last hour. It was intense. To me, both my births were a lot on my hips more than like contractions on my belly. I had like this really like strong low back hip pain. Um, and then during birth, it's just like I don't know. I was more terrified, and I was just like eyes locked in that midwife and, and trying to push, which pushing is something that is really also not. I don't know. It's nothing like I thought it would be, but I think like the moments before actually birth are way more painful than birth itself. When you're like when that pain like kind of culminates, I don't even know. I think there's a medical term for it. That is really intense. It's like all to me was like all on my hips. I don't know. It feels like it's like really pushing apart. Um, and then birth itself was not as painful uh, as like those few moments prior to. But then I think also your adrenaline just kicks in. It's happening. I think I was lucky, and I tell this. So I'm a newborn photographer, and I hear a lot of birth stories because I love them. I feel that there is a combination of factors that need to count in your way. I feel that your body needs to be ready and you need to have like your hips really open. Some women don't can do that. Like the body's just, you know. I feel that the fact that my births were very quick, that helped a lot too, because I can't imagine tolerating that pain for like 12 hours. Some of my clients have like this really long births, 12, 16, 20 hours. I just can't, I don't think I could tolerate that. So I honestly, I have a picture of my, so I have a picture of my birth. Like the nurse took, one of the nurses took a picture when they first put my son in my chest. And on the picture, I'm looking at my husband with a pretty terrified face. Like, what happened? What is this? So it was no longer first sight. It was more of like, what is going on? And then after those minutes, uh, the hospital was really good in allowing us that like golden hour where I just had him on the chest, and then it was when it like really sunk in, and then it was absolutely love. From there on, like I always say, he's my soulmate. He's that soul that came to the world to just match mine. So my second, so then the situation was I was 37 years old when I had my first baby. So I'm already like an older mom. And then with my ovarian cancer passed and the fact that I had one ovary, that was all things that we were like, is it even possible to have a second one? So we decided that if we're gonna have a second one, it needed to be pretty soon. Like we couldn't wait too long, and we really wanted a second one. But at that point, we were so happy that it happened to us. We were parents that it was like if it happens, it happens. If it's supposed to be, it's gonna be. So we were like, way like more relaxed about it. We were really enjoying that parenthood and the fact that we had that baby and he was healthy and we were like I was healthy. And so 3 months after my 3 4 months, yeah, 4 months after my first birth, I decided to stop the birth control that they put you in. Uh, and I'm like, it's gonna happen. And at that point in our heads was like, this is gonna take at least another year and a half. Like it took a year and a half for us to have one. Now, like I'm breastfeeding, I just had this baby, like my body's probably like not even ready for it. So let's see what happens in the next year, maybe a year and a half. And then if it doesn't happen, we are good with having one baby. And when my first baby was 6 months, I was pregnant again. So my kids are 14 months apart. Uh, and that time, I was not checking. I had pregnancy was not in my head, like that I was going to get pregnant that soon. So I start to feel like really bad. I start to feel like really tired, anxious. And we went to Costco one day and I almost passed out. Um, And I told my husband on the way home, I said, I'm feeling really, really bad. I don't know what's going on. And I told him, stop at the pharmacy and let's get a pregnancy. Because I told him, like, if I'm not pregnant, then I need to call my oncologist, like, right now. And he's like, are you telling me that we're either having a baby or you have cancer? And I'm like, yeah, pretty much that's what is coming in my head right now. So we stopped at the pharmacy. We went home. I did the test and immediately it was positive. And I'm like, well, not going to believe it, but we're going to have a second one. So now, now they're 5 and 6, and they're 14 months apart. They're the best of friends. So I had two very different postpartums with both my pregnancies. On my first one, I was on that sense of gratitude, and I was like feeling the luckiest person on earth. I never felt that happy. I spend a lot of time just like staring at his face while I'm holding him on the couch and like snuggling. And I was very present and had a lot of gratitude for that miracle baby, really. Um, on my second one, I had a tougher time. I think I was more tired throughout my pregnancy, and my postpartum was harder. So I had first I had it was connecting with my second baby was not as immediate as it was with my first baby. So that emotional connection didn't like establish. It was not a movie like connection. I of course had all my maternal instincts. I was taking care of him, but like I felt that it took me a couple months to really fall in love with that baby. I had a lot of concerns about my first, uh, like I think silly concerns that every mom has, like, will he feel left out, or like, how is this gonna be? So it was a longer time to connect with my second, and then I absolutely fell in love with him. He's just, I think he's the cutest thing in the world. Don't tell my first, but he, and then I had postpartum depression on my second baby, and that was really hard because it went untreated for a long time. I felt that again, I failed on being heard. I failed on communicating clearly. Um, and although I don't like women to say that they fail on themselves, but what I feel is that I went on that appointment postpartum and they give you that questionnaire, and I was embarrassed to fill it truthfully because I felt that I was being ungrateful that I had that baby. So I pretty much lied on that question. I tried to like make things look better than they were for me at that time. And then I mentioned in person with my doctor, I said, you know what, I'm feeling very overwhelmed. Um, and then she's like, yeah, you have like two babies at home. It was kind of like, yeah, you're like overwhelmed because you do have two babies at home. But I felt that I failed on being truthful on that questionnaire, and I tried to like, make things look better than they were, and I was not okay emotionally. But it took a good year and a half postpartum for me to actually first admit publicly that I was not okay, and then to actually advocate for myself and say, I need help. Yeah, I feel that anger is a symptom of depression. I'm not a psychiatrist, but I feel that anger is a symptom of depression and is how it transparent in some people. I was not depressed in the sense that I was sad or I wouldn't shower, I wouldn't get out of the couch. I was not depressed in that sense. but I was so irritable. Like anything would just like set me off. And when some triggers like would set me off, it would set me off in a way that I had never experienced in my life. And I would really think, who is this monster that is just coming um, out of nowhere? And I couldn't control it. And after I had like that burst of anger, I would just feel shame. I'm like, what I'm doing? Like, who is this person? What is going on? Um, so I feel that thankfully we're talking more about depression, postpartum anxiety. Um, and yeah, to me was anger. And it's it's a very ugly side of you that you never saw before. And when I feel that, at least talking on my experience, like I imagine being this mom that is singing and kind and making all these amazing meals and like just, and then suddenly I'm this person that everything irritates me, and I'm just having this you know worse, and I'm like, what is going on? Like, that's not the person I want to be. um and I can't control it. If I could give like one word of advice for both like women going through feeling something is off, or for moms that are like struggling with the shame, I would say try to advocate for yourself. Like, try to speak up. It's not easy, especially when there is like shame or motherhood, especially. There is like this gold standards that I don't know who created, but someone, like, clearly not a mom, created that this there is this magical world, and motherhood is very hard. And it's amazing, but it's incredibly hard. It's the hardest thing I've ever done in my life. Um, and you're like thinking that you're gonna fail at some point because you're not a perfect human, and you're just like waiting where that thing is gonna drop. So if you're like feeling, I think in both cases, if you're feeling you're not yourself, something is off, just like try to approach your doctor on maybe a private space is the best, but be very assertive that that is not your normal.